Hey there, Sono peeps. So here we have a transverse view of the scrotum. Immediately you see that the left testicle has fluid around it. So this is a hydrocele, no big deal. Right testicle is normal. Here's the inguinal canal of the right testicle, looks good. See, all this would be spermatic cord. All right, so here's the left testicle. You can see the hydrocele, a little bit of fluid. This is not to be mistaken for the epididymis. This is the appendix testis. If this twists on a patient, they can have a towards appendix testis, which is a common cause of pain in the pediatric population. So there it is again. Here is the beginning of the epididymal head there. This is a testicle. This is mediastinum testis. And then here's the entire epididymis. Epididymis again, hydrocele, and appendix testis. So epididymis, appendix testis. In real time, you'll see this kind of flopping around in the fluid. All right, here's a panoramic view showing the hydrocele. And here's the left inguinal. Again, you can see the spermatic cord. Here you also have the pampiniform plexus and all the vessels that go down into the scrotum. This is a good spot to check for inguinal hernias, also varicoceles. And then here's another panoramic showing the entire inguinal canal to scrotum. Got the hydrocele, testicle, epididymis, spermatic cord in the inguinal canal, and then here you got the peritoneum. A little bit of piece of the pubic bone here. All right, on to the next. Here's another one. Here's the twins view, right and left testicle and transverse. A little bit of flow. Good Doppler flow. Again, this is the mediastinum testis. This is a testicle in longitudinal. And then those left testicular pain. So here in this area, you can see this heterogeneous structure is not the epididymal head. This is the epididymal head here. And then you got this heterogeneous structure. And that is a torsed appendix testis. Super common. We see it a lot. There it is again. These can get bigger. They can become very inflamed. They can cause inflammation around the testicle. They can cause epididymitis. They can cause scrotal wall thickening. But usually they're about like this and they go away. Patient just requires anti-inflammatory pain medication like NSAIDs. All right, on to the next. Okay, here's the third one. Transverse view. Both testicles. Tiny bit of hydrocele here. Epididymal head here. Another epididymal head cyst. Again, no big deal. Here you start seeing some fluid there. I sometimes do this to get all the measurements in one page, make sure everything looks pretty symmetric, and I'll measure everything on one page. Usually this measurement box will be down here, but you can click on this part right here with the arrow and drag it to here so it doesn't block any of the structures. And then here in the inguinal canal, right inguinal canal, there's this large cystic fluid collection. There's a panoramic showing the whole thing. Here you can see a little bit of the epididymis, beginning of the testicle. So it's in the right inguinal canal. And here you can see it where it tapers down. So the peritoneum would be somewhere over here. And here you have a encysted hydrocele or a spermatic cord hydrocele. And here, this structure here, since I'm angling from the inguinal canal towards midline, this will be a little piece of the pubic bone. And then this right here is the penis. So you got the corpus cavernosum, and corpus spongiosum. So yeah, this was a case of encysted hydrocele. Hope you found this useful. Take care.